Hello, good evening, friends. So, once again, good to see you back for the final session. We'll have some discussion with regards to that. I just would like to verify whether I'm audible or not. I request, I think I can unmute all. Okay, now I think all members are self-muted. Any one of you can please reply to me whether you can see the screen and can hear me. Dr. Jigar, can you hear me?
Hello.
Yes, Dr. Jigar. Okay.
Yes, sir. I can hear you, sir.
Okay. Can you see the screen also?
Yes, sir. I can see it.
Okay. Okay. Thank you. Thank you
Yes,
for
sir.
your
It's visible.
kind
Yes, sir.
reply. Okay, dear friends. We started quite back with competency, MCI competency, competency-based medical education, right? And we have gone through all the competencies. So now we know what is competency, then what is the domain, what is the level expected, whether it is core or non-core, what would be the teaching learning method, what would be the assessment method, then whether certification would be required, what is vertical integration, what is horizontal integration, right? Now, looking at this competency, it is not directly possible to formulate a timetable. You'll have to work out, and that is how we started with dividing the competency into various objectives. So we divided various competency according to the topic wise allocated to group, and group members created various objectives, and now at the end we have got almost 90% objectives framed. Some of the systems still needs to be reorganized, and objectives need to be modified. What is our aim is to, first of all, fit into this teaching learning hours as directed by Medical Council of India. Successfully, we have, you can see, induced or created a timetable, and looking at this timetable, we are almost equal to the lectures 70 and 73. So no issue about that. But small group learning, which also includes DO, right, where 160 hours are being created by us, while MCI is permitting, it can always permit more, but unfortunately what will happen, will not be able to fit that into our timetable. So we need to restrict to 110 hours, but still there is 160 hours. So we need to cut down, and those areas in which we need cut down, I have already marked that into yellow color: CVS and blood, general microbiology, CVS and blood, GIT, hepatobiliary, and respiratory system, right? So still 50 hours needs to be reduced from that. If you look at this self-directed learning, there are 8 sessions, and if you feel that you can give 1 hour session, that would not be a problematic. But ultimately, if you want more, no problem. But this is as directed by MCI, minimum should be 10. So it is not often that much issue, and we can reduce that from our normal teaching learning. So not a great deal. You can always engage students more because this is a free time which you are going to occupy. So as far as you are not going to put it in your timetable in routine teaching hours 9 to 5, it is not going to affect your timetable. So it's not an issue, but definitely this needs to be reduced down, and this needs to be cut down to 110 hours. Next, so there are areas which we need to work on that. Next that we need to devise is our overall sequence of how we are going to conduct our teaching learning in the subject. When student would come, we'll start with general microbiology, immunology, and then we'll go according to systems, right? So you can see what will happen from our competency. We have derived our objectives, right? But it is very difficult that you cannot put in your timetable the name of your objectives and name of your competency. Both is very tedious. So I'll just show you. When you prepare your weekly timetable, you need to put the name of a topic. As for example, you can see over here, introduction microbiology lecture, history of microbiology, that is a lecture, microbial world, it's a demonstration. So remember, now what we are doing over here, that one competency is now converted into various objectives, right? And remember, a cluster of objectives is a session, right? So you can see over here, now we are naming this particular session as introduction microbiology, and that would be the lecture. And in that lecture we are going to cover this many objectives, right? So that you need to define. That is very important, because if lecture is 1 hour, you can either reduce it down or you can increase the objectives as you can do it. How much is feasible, that we need to decide, right? So if you see, there is a direct link. You can see this is our list of topics to be covered during 1 year of teaching learning. So if you see over here, the first session is introduction to microbiology, and that is lecture, right? And that will directly coincide with this one, introduction microbiology lecture, and these are the objectives, right? What you need to teach them during that session. If you go to the next one, microbial world is a demonstration. Over here you can see microbial world is a demonstration. So you can link it over here. Microbial world is a demonstration. And what you are supposed to teach them in the demonstration, you take them to the class, you try to organize various pathogen. Either you take a microscope, or you take a chart, or you take something else. You can take a specimen and show them which are the different type of pathogens, right? So they should be able to enumerate and identify common viral, bacterial, fungal, parasitic disease, right? So that is how we are linking. So you can see, according to that, you go on defining that, right, one by one. So over here we can see the general microbiology is almost complete. Then you can also organize a part ending examination for that, right? Then immunology would start, and when you put your both the subjects in timetable, you can see over here that we are starting two systems simultaneously, right? So one is immunology and other is general microbiology. So both the system, general microbiology and immunology, would start together. So that you need to decide in your department. Over here, if you see, general microbiology we have almost completed, immunology we have completed, CVS is still remaining, GIT, hepatobiliary is almost completed, musculoskeletal is almost completed, CNS is also completed. He has also worked a lot of things with regards to this one. CNS, vertical integration. Respiratory system also, you can see almost completed. Still, genitourinary and sexually transmitted infection is remaining. Zoonotic infection is remaining, and miscellaneous, that is another zoonotic infection, I think still it needs to be worked out, right? So what is happening over here, we have devised this objectives, and that is converted into session. That is good for general microbiology. Immunology is also good. We need to work out in cardiovascular system, right? Over here, you can see still it is not properly divided into sessions, and it is very difficult over here because competency is divided into objectives, but objective needs to be clustered according to the teaching learning method, and that is session. That is what I said, right? So what we need to take in that, as for example, rheumatic fever, one lecture, and you talk about some objectives. Then you have another session, that is small group learning, a case discussion, and you have got objectives, right? So that is how we need to plan it out. But I tried some of the things to change, but there is plenty of things, and we need to see. As for example, over here, Kala Azar, there has to be one lecture, and in that one lecture, how many objectives are to be covered, right? That is one session. Another session would be case-based learning. See, over here it is very confusing, right? One competency is divided into lecture, CBL, small group discussion, and there is no specification that how long it will continue, right? So that needs to be clarified, like you can see in objective in immunology, right? It is very clear what you need to do in one particular session. It is very specified. So your supportive staff, your co-staff will be able to conduct that session appropriately. Over here, there needs to be some refinement of that. Okay, gastrointestinal and hepatobiliary. Okay, this is good, but once again over here, you can see what you are going to do with this 4-hour session, right? Either session can be 1 hour lecture, or it can be 2 hours of practical, right? You'll not get 4 hours at a stretch anywhere. So 2-hour session is going to be a DOP, and that there needs to be another 2-hour session of one more DOP. In first DOP, what we are going to do, in second DOP, what we are going to do, the objectives needs to be separated, right? So that is some work. That is not that much of great work, but only few things to be clarified. Musculoskeletal, okay, it has been named appropriately, like this anaerobic and anaerobic infection, but gas gangrene, tetanus and botulism, yes, it is lecture. This is small group discussion, right? So over here, you can see it is going to be very clear if we frame like this. As you see in immunology, if you can follow this pattern in all the subject and all the section, it will be very easy, right? Competency divided into session, then appropriate teaching learning method, and in that particular method, how many objectives you are going to cover, right? So that is how our ideal plan should go for. Zoonotic, okay, once again, you can see we need to give the name of a session that is still remaining, right? Naming of a session is important because it becomes very difficult when you put it in your timetable, right? When you put it in your timetable, you will not be able to name it according to competency or according to objective, right? Because we are going to cover 8 to 10 objectives in particular session. Sorry, just a minute. Oh, ಬಿಟ್ಟು ಆಮೇಲೆ ಟೈಮ್ ಮುಗಿದಿದ್ದು ಏನಾಗುತ್ತೆ? Okay, so I request let the member do some of the things editing over here, no problem. But it is very important that you copy down all the objectives into your sheet, right? Prepare your own Google sheet, copy down all the objectives over there, and once you copy down, you start working on your own for your institution, right? Otherwise it will become very difficult, because if some of the system is not going to be corrected, we'll have to wait for a pretty long period. So it is ideal that we start working at our own institution, but this sheet is also going to be over here, and we can continue working over here, right? So once all objectives are completed, then our session would start. As for example, you can see we don't have the name of a session anywhere, right? So competency needs to be divided into the sessions, and each session would have its objectives, right? So this is over here, we need to change the name of that particular session that is remaining. So over here, we don't focus. See, once you read this, it is all right, domain level and that all thing. Even I say that you don't focus over here about assessment, you don't focus about vertical integration, you first focus on horizontal integration, right? First of all, we should be very clear that what we are going to teach in one particular session. Once we are clear, the same way, if pathology is going to be very clear what they are going to teach in their session, then we can talk about horizontal integration. Don't right now decide that this portion is going to be taken by pathology, right? As for example, in some of our objectives, we have already stated that this is going to be taken by microbiology, this is going to be taken by pathology, but still we are not sure what they are going to take it. As it has been said in a session by Dr. Prakash, that how integration would happen. Integration would not happen nationwide. Integration would happen according to the institutions. Pathology department of your institution, pharmacology department of your institution will sit with microbiology, and then they will decide what they want to integrate, because their perspective would be very different, right? So first of all, once again, I'm repeating, first competency. Competency is to be divided into various sessions. We'll have to name the session. Then what would be the method of that session? Teaching, learning, lecture, or it is a demonstration, or it is a DOP, or self-directed learning. Next would be SLOs for that particular session. Whether it is a lecture, how many SLOs would be covered? It is demonstration, how many SLOs would be covered? If it is DOP, how many SLOs would be covered, right? So once you go over there and your timetable, now you can start putting that into your timetable, like this one. So once you put it into your timetable, you will come to know that there are certain nearby topics which you can see, right? In the same month, pathology and pharmacology are also teaching the related topics. Once you see that, then you try to integrate, right? Integration, as a separate session of integration was taken. So the method, first of all, try to teach them system wise simultaneously, right? I'll show you this timetable. You can see we are trying to teach them simultaneously some of the systems, like microbiology, pathology. They are trying to communicate, right? CVS is going to be taught like that. Whatever is possible, you start with that. Don't focus 100%. Focus the small portion, and then gradually it will increase, right? It will not be possible to have 100% integration right from the beginning. So once you see that, this is, we are trying to go for temporal coordination, right? Temporal coordination when systems are running simultaneously. Second thing is nesting, right? So as for example, once again, I go back to this one. I'm taking about one immunity lecture. And this immunity lecture, if I see it is not able, I'm not able to integrate with any other subjects, then I'll go for nesting. That is one type of integration in which I'll try to cover objectives of pathology, objectives of pharmacology, if they are there, and which I can take it over here, right? Over here, there is no integration of subject, there is no integration of teachers, but we are trying to integrate the objectives, right? Objectives which is being derived by pathology, objectives derived by pharmacology, right? So that is nesting. If you see that some of the sessions, basic microscopy, and suppose in pathology also there is about microscopy, then you try that you can make one session, right? And making one session over here, you both are coming on same platform, and now we are having a real integrated lecture that we used to call it in earlier time, right? So that is integration, that is correlation, where one platform is being used and objectives are merged. When objectives are merged, we'll have to see this integration. Okay, you can see this competency. I have put this competency into our Google Sheet. You can see over here, there are certain topics which need to be integrated, right? Over here, you can see forensic medicine, right? Integration with forensic medicine, integration with forensic medicine, integration with community medicine. And there are some of the integration with pharmacology, right? So pharmacology, forensic medicine, and okay, you can see over here, this is pathology. Okay, if I show you uh, microbiology integration, yes, this is microbiology integration. Over here, you can see these all are the competencies that are taken from microbiology. These are the competencies which are going to be taught in pathology, right? Up to this one, the this whole series, right, up to pathology. And now you have to decide, right, that which competency can be taken up by microbiology predominantly, which competency can be taken up by pathology predominantly, and you don't need help of pathology, you take it, then it will become nesting, right? And if they are going to take it, it will be a nesting for pathology. If you feel that you can have a common session, then you try to identify this competency, try to derive the objectives, and try to mix the objectives as it has been described, rather discussed by Dr. Prakash, right? How you can merge two sessions into one session, right? That is the process of integration. So this is the competency which is there. I'll show it in our sheet in which it is over here. Okay, right? So you can see over here. And these are the competency which we are sharing with pharmacology, right? So these are the competency, and you can see most of them competencies, basically pharmac people can take it, no problem. So it will be a nesting from pharmacology. Microbiologists may or may not be needed. Very similarly, you can see there are certain competencies in community medicine, right? This needs integration. So if feasible, try to identify few of the competencies in which you can go for correlation, while most of other competency will go for nesting. Once again, repeating, nesting is when you cover up competency of other subject in your session where the teacher is not required, right? Correlation is when there is a sharing of information, a session is on common platform, and both the teachers are there, and both the teachers who teach their portion, which is devised by common understanding that there are 15 objectives to be covered. The 7 objectives will be covered by pathology first, and then 8 to 15 objectives will be covered by microbiology, right? On single session, right? So this is sharing. And then another thing, as discussed in our integration, you need to devise some of the clinical cases, right? Clinical cases should be used for linker. As for example, if we are teaching about tetanus, and if we prepare case-based learning of a tetanus, don't worry about pharmacology and pathology, because the clinical case learning, the same case will be there in pharmacology, same case will be there in pathology. When case-based learning is going to be there in pharmacology, they will use the same case, but they will not touch the microbiology portion and pathology portion. And pathology would also teach about the portion which is to be covered by pathology. Remember, over here, this may or may not be a correlation, right? You don't need to come on one platform. It can be isolated, but remember that it is linking three subjects. If you can bring all of them for a one platform, good enough, but it will be very difficult. But then separate sessions at separate time, no problem, but at least the clinical case is common and it is going to link all the subjects, right? So that is what we are going to achieve at the end. So this portion, I'm putting it over here. Next, what you need to do is have a discussion with the experts in your college with pharmacology and pathology primarily, secondarily with forensic medicine and community medicine as they are moving to part 1, and then if feasible and possible, medicine, surgery, obstetric and gynecology, right? So that is how the session needs to be, rather teaching learning timetable needs to be scheduled like. Okay, so this is in brief what we have achieved till now, and still there needs to be some of the works which needs to be done, right? In a common, what we can do, there are one more important thing is this one, logbook. Logbook, as it has been taken in a session, should include all performance and shows how. And this, when you prepare this logbook is simple, as I said, is a log of activity. So logbook, if we can prepare along with the practical manual or journal, that would be very nice. But thing is that this competency needs to be broken down into activity. So as it has been explained earlier, gram stain, first of all, we can have uh, first introductory lecture of gram stain. Second would be demonstration. Then third, the student would be performing, right? So there would be 3 activity. Very similarly, we'll have to divide all this into different activity, right? So what we can do, we can continue working on this sheet and we can prepare a logbook of this particular all performances or all competencies. And once we complete that, the same thing, we can put it in our logbook. We'll also try to, we'll create a Google Doc in which we can start working on logbook, and if possible, we'll divide that into same different groups, and then we can come to a common format, right? But once again, working simultaneously is very easy and also very difficult, because if one portion is not going to be corrected properly, we'll not be having a proper logbook. So friends, over here, I'm concluding my uh, discussion on that, and we can have a discussion about what we can do in a future. So this is what I plan out, because we'll have to close this webinar series, but we can continue on WhatsApp, we can continue on Google Sheet working, we can also continue in Google Classroom, right? So I invite your suggestion that how we can go forward, and with that I conclude over here, right? So any suggestion, any comment, you can please raise your hand so we can discuss that. Dr. Prakash, you can, would you like to, yes, unmute yourself? Yes, Dr. Prakash. You are unmute. Hello. I think maybe some technical problem with that. Dr. Prakash, you are self-muted. Dr. Jigar, okay. I'm not sure whether you can. Hello. Dr. Fatima, you can, yes, you are self-muted. Dr. Sarvat Fatima, you are self-muted. You can unmute yourself. Okay, yes.
Yeah, sir. Good evening, sir.
Yeah, good evening. Good
I'll
evening,
work
madam.
on the respiratory system, sir. I will try to reduce further. I think I am exceeding some 2-3 hours more, so that I will reduce up. And next thing is regarding the practical this thing sessions. Now, I think we have to previously we were having a record which was having a lot of theoretical part. We have to
Yeah,
remove everything in that, and we have to have only the competencies which are need to be skill-based competencies we have to put in the practical record for the students.
definitely, definitely. You can have
So,
a,
like, is it going to be, yeah,
you can say this would be
is it
our,
going to be standardized?
see, it is, I think, left to the institutions, right? There is not going to be any uniform across the nation, right? Uniformity across. But as far as possible, it should be very nearby. We'll try to make it, which is almost very similar. As for example, in Gujarat, one of the university, Gujarat University, has taken the lead and they are preparing one logbook, right? So basically, there will be a variation. But remember, whatever may be the logbook, this would be our important components. You can see over here, right? All competency. This needs to be covered in our practical manual or logbook.
Yes, I think 23 are there. So we need to focus more on that rather than other things which were earlier present, like immune
Definitely.
system, this, that, all those things.
Yeah, definitely,
Yeah, so
definitely.
we'll work, sir. We'll work together, sir. No problem.
Surely, we'll work on this worksheet and we'll also communicate through our WhatsApp, right? We'll
Yeah.
continue.
Yeah. Yes. Regarding this applied case studies, sir. Applied case studies we are having for 5 marks in the university exam. So the distribution pattern will be the same, or will it be like different now?
It will be
Marks
decided by
distribution,
university.
I'm asking.
It will be decided by university. That is still MCA has given the guidelines, and further detailing will be done by the different universities, the experts which is sitting there, right? So many of the things are being
No,
left to
till
the
now we are
institution.
having only 25 marks for the practical. 25 for the practical session and about 15 marks for the Viva OC. So
Yeah, so
altogether,
it will
Viva plus
be,
practical 40 marks. 40 marks were there.
yeah. So YY is now will be a part of practical only as per the MCI directive, right? So
But practical session, I think it will be like increased in marks. I think so, as per the new curriculum, or it will remain same.
I'm not sure what was the marking distribution for. I think it was 100 marks for a theory, 200. There will be 200 marks which were there,
Yeah.
and practical. I think I'm not very sure what was the marking system for that. Right? But once again, we'll put that. If there is a clarification, we'll put it over here on a Google Sheet, right?
No, because it has to be uniform. As like if tomorrow the university asks us to represent, so we have to
Yes,
be very clear about it. So that's why
madam.
I'm asking.
Yeah. I just forgotten that. I don't remember that. But if you go to Google Classroom, there are resources, and in the resources, one of the booklet is about the assessment, right? And in assessment, all the details are given, right? About practical class, about practical examination, about theory examination, what should be the type of the questions, and what would be the method of their assessment. It is very well clarified. MCA has already published that assessment booklet.
Okay, so we'll check it.
Dr. Mukesh Kumar, yes.
Good evening, sir.
Good evening, good evening. How are you? Fine?
Fine, sir. Actually, got busy in the COVID one, sir. So there, I think last class I missed it.
Okay.
We having load of a test there, sir. Actually, sir, GIT I worked on it, sir. That 4 hours what I have written there. Actually, I mean this 2 hours plus 2 hours. So I'll just make it clear there why the 4 hours is there. So that in DOAP actually whatever the objectives are there in GIT system, it is all in the second one, sir. So I'll put
Right.
it DOAP.
Okay.
I'll separate it like that there also.
Yeah.
Sir.
Session
And
1, 2
regarding
hours, what are the objectives? Session 2, 2 hours, what are the objectives? Right? That we need to
yeah,
separate.
yeah,
Yes.
I'll just make a separation of that. I think that 4 hours is I'll correct it that, sir. And regarding the
Okay.
logbook, sir,
Yes.
depending on how many demonstration we have to do, demonstration part is the MCN. That demonstration part we have to split according to the 2 hours depending on the session how much we are giving, sir. That how much we are provided by the MCI, the new curriculum, sir. So that we have to, it means the logbook will be almost, I think, very simpler and good in numbers, sir. Means
You can see over
much,
here. You can see over here the screen. These are the
yes, sir.
competencies to be covered in our logbook. Right.
Yes, sir, yes.
This is all DOP session and some of the other which is shows how that needs to be covered in our logbook. Right.
Yes, sir, yes, sir.
Yes. Right. Dr. Nagaraj,
Thank you, sir.
welcome.
So good evening, sir.
Good evening. How
It
are
was a
you?
good session. I'm fine, sir. Sir, one thing
Okay.
is, you just gave an example of leishmaniasis
Okay.
in your talk. So I think, instead of going for the leishmaniasis and things like that, and adding a burden at the beginning in the systematic portion, we can take it in the national program level at the end, and also have an integration part of it coming in very easily. All national programs is coming with Prakash. I think there we can integrate and reduce the entire thing in that fashion, sir. This is one of the things
I'm not sure you're talking about.
just now you said about the CBS or something system you were talking about, where
Case-based learning. Yeah, case-based learning.
case-based learning. So these
Yeah.
things can come to the national program level where these are covered actually, and that can be taken as a part of it, and no repetition can be. The repetitions inside our own faculty, I mean our own subject can be reduced.
Yes, definitely. But leishmaniasis, which was shown as case-based learning, was just an example. It was just an
Yes, sir.
example
That
of that.
example I just took it as a thing. Similarly, we have other things also. Malaria. Then we have got many things like that. We can actually reduce it that portion, sir.
Definitely.
And as
Once again, there
yes,
will be
sir.
a variability, sir. If somebody is
Yes,
from
sir.
the Bihar, right, Uttar Pradesh, they need to put leishmaniasis as a major component, right?
Major,
Somebody
yes,
from
correct. True, sir.
somebody from the Gujarat, they need to put elephantiasis also as an important case, right?
Yes,
So
yes,
that
sir.
definitely there will be some variation, right? But definitely it has to be set according to the timetable, and there will be
Yes,
some
sir.
variation where we want to put it.
Sure, sir. Second thing is,
Yes.
sir, are you sharing that Google Sheet which you had shown about this thing, sir? Timetable?
Yes, that is about blueprinting.
Yes, sir. Blueprinting. Blueprinting, you
So
have already sent it, sir. Oh, that is from the blueprinting one, sir.
yeah, it was
That case,
Google Sheet of blueprinting, case-based
that
learning.
is not
Okay.
that
I'm going to
because
put
it helps us to
I'll put all the resources as early as possible. Actually, I'm also engaged with
yes, sir.
setup of COVID
Many,
laboratory as per MCI directive.
many,
That's
many
not the
things,
problem.
sir. I understand, sir. And my portion, I am actually doing it up, sir. Probably in a few days, this weekend, you will receive my part of it.
Surely we'll all will work on our Google Sheet, and we'll also continue to discuss on our WhatsApp, right? We'll continue.
Sure, sir. Thank you so much, sir.
Thank you very much, sir. Dr. Prakash, are you able to? I think you are already unmuted, but probably some technical problem. Okay, so it was a very nice discussion. I think I don't see any other okay, 100 marks is Dr. Sain Leela. Okay, right. So I just forgot that. There are 200 marks of theory and 100 marks of practical. That is what you wanted to convey, right? Okay. We can thanks all the participants for being part of this wonderful event. Because of time restrictions, right? We will not be able to continue our webinar series, and we'll be ending up over here. But definitely, we all will be working on this Google Sheet and in WhatsApp, right? We'll be able to devise as clear as possible our competency-based syllabus and timetable, right? So
you can for another 10 minutes.
Just one doubt, sir.
yes.
Good evening, sir. Sorry to interrupt. I had a doubt regarding the logbook. Maybe you mentioned it earlier, and I'm not sure. Is the student has to do the gram stain many times before he's certified? So every time will he be entering into the logbook?
Definitely, if it is 5 times, there has to be entry 5 times entry.
Okay.
because that would be the evidence that he has performed 5
Right.
times.
Okay, sir. Thank you, sir.
Okay, friends. So it's a time to say goodbye. Thank you for being on the board, and we'll continue work, right? Okay.
Sure, sir.
Thank you,
sir.
Dr. Sanjay, and thank you, friends. I mean, this batch has done it very systematically. Dr. Sanjay Mehta is an excellent leader, and I mean, the second batch will be starting from 15th of August. So that also has a number of participants. This group will continue. We will continue our interactions, and anytime anyone, any refresher is needed, I think our team will be ready for any kind of activity. Thank you, Dr. Sanjay Mehta.
Surely, sir, I really appreciate your kind words. It was an opportunity given to me by you, and I really enjoyed working with the many experts on the subject, right, across the country. And it was nice, and we'll continue to work on it. Definitely with your help. In case we need, we'll once again organize a session, right? Thank you.
Yes.
Goodbye, sir.
Thank you.
Okay.
Goodbye.